It is Wellness Wednesday, and we are discussing hip pain this morning and how you can know if your pain is really from your hip. Joining us in the sponsored segment this morning, we welcome Dr. Ramy, an orthopedic surgeon at Memorial Healthcare Center for Orthopedics. Thank you for coming in.
Thank you for having me.
Yeah, good to have you as always. So, let's talk about hip pain itself. Every now and then, some of us get a little twinge or something, but when should someone start to be concerned?
It all depends on your history. So if it's a new pain or has been going on for a little while, most emergent hip pain needs attention right away because it's a fall, it's trauma, you can't bear weight. But if it's something that just happened in a sports event and you can rest it, if you're able to put some weight on it and you can put off and give it time to rest, then about a week or so. And if it's more than that, you should probably see your doctor.
Well, you expand on this a little bit then. You said certain groups are more at risk. Who is most at risk for developing hip pain?
So most at risk are usually elderly patients or people who had a trauma. Those two people, athletes sometimes. If you have a lot of extra weight gain over a short amount of time or over time and you've fallen, then there's more risk of fracture or injury. And rarely, but sometimes children who have potential viral infections and have hip pain suddenly, which usually is benign.
Okay, so there's different factors at play there. As you said, you'll lead them in the right direction as far as seeing what's up. But, what are some of those key indicators that your hip pain is coming from the hip joint? And you actually brought a little show and tell for us today. So what are you looking for when it comes to diagnosing that?
So the majority of people who come in with hip pain have chronic hip pain. It's usually osteoarthritis. It might have been an old trauma, but developed in arthritis. Some athletes have like cartilage tears or injuries, but looking at this model here, you have a little idea just from a three-dimensional perspective of what is the hip. And a lot of times, a quick lesson to patients that, our hip joint is deep inside the hip. So what is the outer part of the hip? There's muscles and soft tissue attachments to it. So if they point to the outer part of their hip out here, there's a lot of muscles and tendons that can be injured that aren't really, you don't need a new hip replacement at that point. So there's a lot we can do without having to do surgery.
Well, with that said, when should a person see a doctor for their hip pain?
So if you've really tried and you tried Motrin, Aleve, naproxen, things like that over the counter pain medicine, rest, lifestyle modifications, if it starts to affect your daily life, you've gone weeks, maybe months, maybe years not doing the things you want to do, or even sharp pain at times that really debilitate you and then they kind of resolve, it's always good to see an orthopedic surgeon because we can help treat you even along the way and prolong the need maybe for a hip replacement if you're destined to have one.
Well, and finally, what are some of those treatment options?
So when you see us, when you see an orthopedic surgeon, some treatment options are going to be lifestyle modifications. If there's a little bit of weight loss, we have no judgment. You come into our office, we always find a way to help you. Physical therapy, pain medicine is kind of weird, veering away from that, more anti-inflammatory and sparingly if everything else fails. And cortisone injections we can do right in the office using imaging guidance.
And then finally, of course, you do your share of replacements, right?
Yeah, and hip replacements have changed. They're 30-year wear rates on hip replacements now. It's a same-day surgery. Surgery itself, implants are in under an hour typically, and we use robotics to be accurate to a fraction of a millimeter. And most patients have a minimal pain, a very manageable pain within days, and within 2 weeks, no cane, no walker, no limp usually.
Interesting to know. Great information to keep in mind. We always appreciate your insight. For more information, you can go to the website you see there on your screen, memorialhealthcare.org, or you can call the number 989-720-CARE. Thank you again for coming in. Good to see you.
Thank you so much.